Hi, I'm Dr. Doris Strader. I'm a gastroenterologist and hepatologist. An academic center is one in which there is always learning going on and always an attempt to try to discover what's on the cutting edge. And not just what's on the cutting edge, but what is data-based and what may be helpful. We live in an information society where there's a whole bunch of information out there, much of which is not necessarily backed up by data. So when one comes to an academic center, we're on the cutting edge, but we also have figured out what kinds of things work and what sort of things don't. My philosophy of care is to approach each case as a new one and to try to impart a little bit of knowledge before the patient leaves. I find that if I'm able to give them just one or two little tidbits about how the GI tract works or the liver works or their gallbladder works, it helps them to understand what it is they're feeling and to take what it is that the advice that I give them and incorporate it into their daily lives. So I like to think of myself as both a physician and a teacher with respect to the patients, and hopefully when they walk out they've learned a little bit of something as well as gotten something to make them feel better.